This question actually comes up all the time with patients that we see in a variety of settings. Most commonly, if someone has had breast cancer and had genetic testing that was negative, and maybe they elected to have the double mastectomy, and they think, do I really need additional genetic testing? Is it really going to be helpful? It may or may not for that individual patient, but remember that the test result that may be resulted for you can go on to affect your entire family, your children, and may be really helpful for someone else to know, even though it may not induce you to make changes in your health care. Now, this question really becomes pertinent because the patent on BRCA1 and 2 gene sequence expired about 5 years ago and led to the rapid proliferation of panel testing. Currently, most of the vast majority of the genetic testing we do is multi-gene panel testing. We test 9 genes at a time, sometimes 20, sometimes over 70 genes at a time, and so we're getting a lot of information. The question becomes, is that useful? There are a few large studies that have looked at this question, and we find that a relatively modest percentage of those patients are found to have a really significant mutation that puts them at risk of either breast or ovarian cancer or some other cancer type. However, for those small percentage of patients, and maybe the average of these studies is probably 4% to 6%, for those patients where we do find those mutations, obviously the results can be dramatic. It may lead them to have prophylactic surgery. It may lead them to have different types of screening, more high-intensity surveillance, and lead to testing of their family members.